The COVID-19 outbreak came to Germany on January 19th, when a businesswoman from Shanghai arrived for 2 days of meetings near Munich with her German partners. After she was diagnosed a few days later, her contacts were quickly traced and tested, and the first cluster of infected Germans was identified and isolated. Dr. Uwe Janssens leads the German Intensive Care and Emergency Medicine Association.
And she infected this man infected 5 others, and in the end we had 16 patients. And then nothing happened more.
Then came spring break, when many German and Italian students make their way to the alpine villages of Austria to go skiing. It turns out there was one super spreader in the town of Ischigo, a bartender who thought he had a cold but was not ill enough to skip work. He infected hundreds of young people, including many Germans. Martin Sturmer is a German biochemist who was himself caught up in the epidemic.
Yeah, we've been to Austria for skiing, and 2 days before we left our holidays, we got a message that the complete region of Tyrol is called the risk area. And when we came back, because my wife and I, we work for a medical lab, and they said, before you come back to the lab, you have to be in quarantine, and we will have to do a test. And so we did a test, and it was positive.
He just kept going to work. I guess he didn't feel sick enough to stay at home.
Yilmaz Gulum reports for Austrian Public Broadcasting.
There was not yet an understanding of what could happen. Up to 50% of people who have the virus don't show any symptoms at all, and a very large number of people show only very, very mild symptoms. Now, it depends on the capacity of a country to test. How many people can a country test per day to isolate the people that are infected, to isolate them from the rest of us?
Chancellor Angela Merkel, a scientist by profession, was the first Western leader to take action about COVID-19. She estimated that up to 70% of the German population could contract the virus.
That was the first time that for me, my perception of the whole situation changed. And when she said up to 70%, I just made a quick calculation in my head that if 1% of infected people die, which was at the time the assumed fatality rate, but all right, 70% of Germany and 1% dies, that means roughly 500,000 people will die in Germany. And that was for me like, whoa. This is not just the flu. This will change a lot of things for a long time.
Germany quickly began developing thousands of test kits, far more than any other Western country. Germany has ramped up quickly and is now testing 500,000 people per week.
For instance, everybody coming from Italy or from skiing or from the risk area in Italy, he was isolated and was tested, and everybody surrounding the family was isolated. So I think at the moment, this led to the point that we don't have so many old people getting infected.
So if you look at our overall positively tested population, you see many younger people below at the age of 60, which have been tested positive, and therefore we have not so much severe ill people in our population, in our testing population.
And everyone just started to test, to establish the test. As soon as the sequence
Melanie Brinkmann is a German virologist.
And I think that's the big advantage we had. And I like to compare it to an iceberg. So I think we saw a much bigger tip of the iceberg than other countries, as Italy, for example. And I think we have gained a lot of time and now had time to prepare the hospitals for the patients that will come eventually.
Once the wave of infection arrives, Germany will be far better prepared than other Western countries to handle it. For example, Germany has invested in a greater per capita proportion of intensive care beds and ventilators, almost 3 times as many as Canada.
In Germany, there are a lot of hospital beds per capita and a lot of ICU beds per capita. For example, in Germany, we have 34 ICU beds per 100,000 inhabitants. That's a lot. For comparison, in Italy, we have 8.4 per 100,000. And so this is fourth the times of bad. So I think we can handle this situation a little bit better than the Italian people do.
Many German experts feel that the country's low fatality rate of COVID-19 patients has a lot to do with the relatively low number of serious cases they are dealing with, but that could change. Dr. Karl Lauterbach is an epidemiologist and member of the German parliament.
I think that the tidal wave is coming, and we will see, let's say, a sharp increase in both the number of infected people and also the number of, let's say, people having severe disease and people dying, unfortunately. So that will happen. But I do assume that we will not get close to the numbers, I hope at least, that we unfortunately currently observe in France, Spain, or Italy.
So I was lucky at the end, and but I think it hasn't changed my point or my view on the complete epidemic. We should respect the virus, should respect the illness, but we don't have to be at the panic mode and don't have to fear this infection.
Right now, Germany has many fewer COVID-19 deaths per capita compared to their neighbors. Almost 7 times fewer than France, 30 times fewer than Spain, 35 times fewer than Italy. But experts here insist that does not lead to overconfidence.
We are not becoming overconfident at all. We are very well aware that in a couple of weeks we may be in big trouble.
In the town of Menden, a symbol of Germany's determination to win the battle against this virus, this school gym has been outfitted to receive anyone who is caught disobeying quarantine restrictions.
Beratschlagen und wenn alle der Meinung sind.
First Alderman Sebastian Arlt says the forcible confinement will be accomplished, if necessary, with the help of the police.
Unterstützung der Polizei durchsetzen.
Germany has given the world a positive lesson in how to deal with this pandemic. Terence McKenna, CBC News, Toronto.